Secondary hypertension is high blood pressure caused by another medical condition. Almost 10% of hypertension cases are due to secondary causes. These can be divided into two main categories: renal disorders and endocrine disorders. Renal disorders account for almost 80% of cases of secondary hypertension. Amongst these, number one is adult polycystic kidney disease. It is an inherited condition in which many fluid-filled sacs or cysts are formed in the kidneys, and they disrupt the kidney function, which is to regulate the blood pressure. Glomerulonephritis is a group of diseases that injure the glomeruli due to inflammation of the kidneys. Normally, glomeruli filter the waste and sodium out of the body. If they're injured, then body cannot get rid of wastes and extra fluid, subsequently increasing the blood pressure. If the renal artery becomes stenosed or narrow due to an atherosclerotic plaque, then the kidneys will receive less blood. These hypoperfused kidneys, they will try to compensate this by activating the renin-angiotensin-aldosterone system, which will increase the fluid to compensate, leading to increase in blood pressure. Hypertension due to endocrine disorders is due to benign tumors in the adrenal glands, called adrenal adenomas. Normally, adrenal cortex produces mineralocorticoids, mainly aldosterone, glucocorticoids, mainly cortisol, and androgens, mainly DHEAS, which is a very long name. You can see it on Google. Adrenal medulla produces catecholamines, which are adrenaline, noradrenaline, and dopamine. Aldosterone is a hormone that is responsible to hold sodium and water in the body as required. As the name suggests, in primary hyperaldosteronism, which is also called Cohen's syndrome, there will be too much of this hormone due to a tumor in the adrenal gland. So excessive aldosterone will hold too much water and sodium in the body, raising the blood pressure. Cushing's syndrome is another endocrine disorder in which the adrenal glands secrete a lot of glucocorticoids that are body's own steroid hormones, again due to an adrenal tumor. These glucocorticoids are also responsible for blood pressure regulation, so excessive level of glucocorticoids in the body will also increase the blood pressure. In pheochromocytoma, adrenal adenoma secretes increased amount of catecholamines in the body. Normally, catecholamines regulate the fight or flight response, which is an acute stress response to a harmful event or an attack. This raises the heart rate, blood pressure, amongst other physical effects. So if the body is secreting a lot of catecholamines, then these fight or flight responses will be exaggerated, leading to increase in blood pressure chronically. And then there are some other conditions that also raise the blood pressure, like in pregnancy. Some drugs like taking steroids for a long period of time or oral contraceptive pills can also increase the blood pressure. In gestational hypertension, which occurs after 20 weeks of gestation, the uteroplacental arteries, they become fibrous and narrow. Due to this, the placenta will not receive enough blood. So the hypoperfused placenta will release some inflammatory markers like macrophages and cytokines into mother's circulation. These inflammatory markers damage the endothelial cells of the blood vessels, causing vasoconstriction and subsequently raising the blood pressure. If gestational hypertension is not treated appropriately, then the BP continues to rise and starts damaging the kidneys. And this will cause significant proteinuria and edema of the legs. This is called preeclampsia. If the baby is still not controlled at this stage, then the mother will develop hypertensive encephalopathy and she will present with seizures, a phenomenon termed as eclampsia, which is an emergency situation because the patient can go into coma. That's it for today. I hope you enjoyed the video. Take care. God bless you all.